Dr. Aronson, in your TED Med talk from a couple of years back, you talk about how nobody likes to get old or likes to see themselves as getting old. And that's largely because of how we, as a society, particularly in the West, relate to the sunset years of our lives. And you've also written the New York Times bestseller and Pulitzer Prize finalist, Elderhood, Redefining Aging, Transforming Medicine, and Reimagining Life, which was published in 2019. So how are you trying to help the public at large and the medical community specifically change their relationship to aging?
I am trying to help both society and medicine change their relationship to aging because it is self-defeating. It's self-defeating for us as individuals who don't want to die young. It's self-defeating because there is incredible evidence that people actually get happier as they get older. Now, are they happier with their bodily changes? No. I'm not saying everything's perfect and that aging doesn't come with some bodily changes that are disappointing, but every life stage has its advantages and disadvantages. But somehow we only see the bad of old instead of all the good. And similarly in medicine, we try and act like older people are the same as younger adults, even while we have this prejudice that among lots of other evidence tells them they're not. So I think it would be better for all of us if we accepted that old age was a natural part of life. We are children, then we are adults, then we are older people, if we are lucky. So if we actually approached old age in the same way we currently approach childhood and adulthood, and I also want to be clear here, we're not fair to children either. There's a word I like to talk about, which is adultism, that we norm onto adults, and anybody who is young or old is at a disadvantage. But generally, if you look at public health, if you look at the structures of healthcare, you will see special things for kids and for adults. And you will see little to nothing or something wholly undesirable like nursing homes for older people. That's not evidence-based practice. That is fiscally very expensive. And it does all of us a disservice because if we don't want to die young, we're going to get old. And it would be better. It's already, most people are happier, but it would be better and we would all be healthier and happier if the system acknowledged the differences and adjusted itself so that it was okay to grow old.
Mm-hmm. Thank you.